Good morning. Thanks for joining us today. I'm Darren Rogers, Health Promotion Specialist for Lambton Public Health. Welcome to our digital video session today to discuss COVID-19 vaccines. And I'd like to thank everybody for tuning in via Facebook Live. We're going to begin with a brief intro from our Lambton County Medical Officer of Health, Dr. Sudit Ranade, and then he'll answer some pre-submitted questions from the public. The second half of our program will open up the session to media to ask questions specifically related to COVID-19 vaccines. Dr. Ranade, please take it away.
All right. Hi, everyone. I have a lot to tell you about. Obviously, there's lots of stuff going on with vaccines, and so I'll try to add some structure to that conversation for all of us, and then we'll, of course, move to the media for questions. But if there's anything that's unclear, please, let me know. It feels a little bit odd speaking into this void because I can't see anyone else, but hi to everyone who's out there, and thanks for joining us. So let me talk a little bit about the whole kind of vaccine situation, the vaccine scene, right? What the different levels are and the different players and who's supposed to do what and how it all works. And then we can talk about some of what's going on here, and then we can talk about some of the questions that people submitted. So let's talk broadly in terms of the world, right? There are multiple manufacturers around the world who are making vaccines, and right now in Canada, we've approved 2 vaccines for use. There's the Pfizer vaccine and the Moderna vaccine for COVID-19. So the federal government has 2 kind of big roles, right? The first role is to regulate and approve vaccines as the information is submitted to the regulatory agency for approval. And that's one of the big roles of the federal government. The other role of the federal government right now with respect to COVID-19 is to procure a bunch of vaccines so that they can be delivered and distributed to the Canadian population. Okay, so that's the role of the federal government of Canada. I'm sure there are others that I'm missing, but those are 2 big ones. Then we come to the province, right? The province's role is to take the allocation from the federal government and decide what to do with it, right? So health belongs to the provinces. So the provinces are going to decide who's eligible at any given time for the batches of vaccines that they have. And so the provinces have come out with their own plans. Each of them is a bit different about who's going to be first in the rollout for vaccines, and recognize that those priorities are going to shift over time with respect to the needs, with respect to the epidemiology of disease, with respect to other circumstances and sort of social and political considerations around who should get a vaccine and why and when, right? And then our job locally is really to take the information that we get from the province about who's eligible and what the priorities are, and then take the vaccine that we're given from the province and then try to give it out in a safe and effective and equitable manner based on the eligibility that the province has determined, right? So those are the 3 levels. There's the federal government, there's the provincial government, and there's us at the local level. So at the local level, what we've done is we've formed a task force that has a partnership model from a bunch of different agencies who are coming together to help support effective implementation of vaccine delivery, right? But of course, lots of questions are coming into us about, well, can we be prioritized? Can we be prioritized? So I just want to remind everyone, right, that the decision around eligibility and prioritization really rests with the province. And that's really important, actually, right? You don't want different parts of Ontario making substantially different decisions about who should get a vaccine and when, especially when the province has got their supply allocated to them from the federal government, right? So our job then locally through that task force is to come together and bring our resources together to help deliver this program and reach out to other community stakeholders and other partners as they become eligible and as we get more vaccine. So let's talk about the local vaccine situation. I'm very, very pleased to say that we did get a small shipment of vaccines earlier this week. So that was just yesterday. And we are working towards immunizing the first priority population right now, which is long-term care home and high-risk retirement home and Indigenous elder care home residents. So right now we're focused on residents. Again, right, we have a very, very small amount of vaccine and also obviously lots and lots of people who would like that vaccine. This is the current priority population that we are focused on. And just to give everyone a little bit of a heads up, we had been planning to go out early today to start those vaccines, but they're just a little bit delayed. There's one thing that we actually really needed to wait on, which was confirmation that the cold chain had been maintained of the vaccines during the transportation to us, right? So all of these vaccines have different storage requirements, and one of the things that you want to make sure between the point that vaccine is manufactured and the point that it actually gets, given to someone is that the temperature and other conditions around the vaccine were maintained throughout, right? So as soon as we get confirmation that during the transport, the vaccine temperature was stable and that it was appropriate for the storage, we can go ahead and start immunizing the people that we need to immunize. It's really, really important. You don't want to go ahead and immunize people if you're not sure about the status of the vaccine. So we're just waiting on that, and then we'll go as soon as we get that confirmation. But it's very exciting, right? So let's all take a minute to recognize how monumental this milestone is, because one, we have a pandemic that has been going on for about a year, under a year, just over a year, depending on who you are and where you're counting from. But to have a vaccine, actually to have two vaccines that are highly effective for a new virus or a new pathogen in such a short time, where we have really good evidence of how well they work, is amazing. It is a huge milestone. And so just before we go on to people's questions, I just want to take a second and really say, let's be very, very thankful for all of the people who've been working behind the scenes on all elements of this, right? From the people who came up with the idea about how this vaccine should work, to the people who are troubleshooting how it could be produced, to the people who are figuring out how it can be stored, to the people who are buying it and getting it and making it happen, and then all the way down to getting it here. And then now to all of us who are going to be helping to get this vaccine into people's arms. There's a lot of work by a lot of people, and a lot of it is really unseen. So let's take a second to be really, really thankful and grateful for all of those people and all of their work on this, because it's come to fruition through intensive work by lots and lots of people around the world. So thank you to all of those people, whoever you are, even if we don't know you or will never meet you, we're really, really grateful for your work. Okay, I'm going to answer some of the questions that came into us, and then I think we'll have some time to turn it over to the media for your questions. So here's the first question. Where do seniors with underlying health concerns fit into the vaccine rollout timeline? So remember that this is a fluid situation, right? So priority groups are going to shift and change over time. The province is going to keep making decisions and updating them, but right now, based on the plan, in phase 1, which we're still in, one of the groups is adult recipients of chronic home healthcare. And if that is, if you belong in that category, then there may be a chance for you to immunize during phase 1. What we still have to figure out is what determines the eligibility for that group of people and how would we identify them. So there's work going on to figure out exactly what that description means. There's going to be lots of this back and forth between local folks and the province to say, can you please clarify, this requirement, or how would we determine who's eligible, right? Because it's important that this rolls out in kind of a consistent way. But having said that, if you're a senior with an underlying health concern who doesn't fit into that category of receiving home health care, the goal, I think, based on the plan, is in phase 2 to start immunizing by age. So it'll start with 80 plus and then go down in 5-year increments. And that's really reflective of what we know about the risk factors for severe disease, right? We know that age is probably the most significant risk factor for severe disease, and we can talk more about that as we need to later, but that consistently comes up over and above other chronic conditions or any other things. It's the most consistent and significant risk factor for severe disease, and so that's where that thinking comes in, and so it would probably be in phase 2. So just to reiterate, phase 1, I have it in front of me, so I'm just going to read it so that I don't get it wrong. Residents, staff, essential caregivers, and other employees in congregate living settings for seniors, that's 1. Healthcare workers, including hospital employees, staff who work or study in hospitals, and healthcare personnel, that's 2. 3 is adults in First Nations, Métis, and Inuit populations, and 3 is adult recipients of chronic home healthcare. Those are the 4 priority groups in phase 1. And so that's where we're going to focus our immunization efforts at the beginning, and then we're going to move on. Most of the problems around who gets vaccine and when will start to go away as we get more and more and more vaccine. Still, there will be people who say, I wish I had it sooner. But as we get more and more vaccine, we'll be able to do bigger and bigger things with it. So just stay tuned and be patient for that, recognizing that we will, as soon as we can, get to as many people as we can. Okay, that was a long answer. So I'm going to go on to the next one. How do we get an appointment for the vaccine, right? So again, that again is going to become more clear as we get more and more vaccine. We can set up sites where people can get the vaccine, as well as a process where people can sign up in order to get it if they're eligible, right? We can't do that now because we don't have enough, and it's really targeted for these groups. But when we get more, we'll build a process for people to do that. And we don't want to do that too fast, right? I don't want all of you to be sitting on a waiting list now for a vaccine that we may not be able to give you until May, June, or July, right? We don't really know how this is all going to go, so we have to take it one step at a time. So when we have a plan for more vaccine to be coming to us, we can make plans for clinics where we can have people who are eligible sign up. And then one good question was, will seniors have to wait in long lines? So first of all, no, right? It's winter. I don't want you waiting out in long lines outside. That's not what we want to do at all. But more importantly, vaccinating for COVID is different than how we vaccinate for flu and other things. We really don't want people congregating in any way, because we don't want them to potentially get exposed to the virus while they're waiting to get a vaccine for it. So we have to do these vaccinations a bit differently than you're used to. There's not going to be a lot of piling up of people, lots of lines, things like that. It's going to be very focused and appointment driven at first, because we don't want people to be, crowded into groups of people while they wait to get a vaccine. And where will we be able to get it? And so again, as more and more vaccine comes, and as vaccine comes that has different properties, so vaccine that's more fridge stable, vaccine that we can keep in different places and where we're less concerned about wastage potentially, we can start moving that to all of the different places, to pharmacies, to primary care providers. Over time, it might become more routine to get these vaccines just, in your primary care provider's office in a clinic, right? But for the early parts of this where we don't have a lot of vaccine, you can't really distribute it that widely. So we'll look at those models as we have a plan for more and more vaccine to come in and different types of vaccine to come in. Why do we still have to wear a mask and socially distance after we get the vaccine? So that's a really, really good question. The answer is a little bit complicated, and I'm going to try to explain it as clearly as I can. The answer revolves around what we can say with certainty about this vaccine and what we cannot say with certainty yet about this vaccine. So what we can say with certainty about this vaccine is that the people who are immunized with this vaccine will have a much lower chance of getting severe disease and heavy symptoms if they get COVID-19. Right? But because of the way the trials worked, because of what they studied and how they studied it, which was basically to give people a vaccine and give some people not a vaccine, and then you wait. And when people have symptoms, you try to see if those symptoms are COVID-19, and then you determine how many people in each group got COVID-19 and how many didn't. But we do know that there are some percentage of people who have COVID-19 and have either really mild symptoms or have no symptoms at all. And this kind of study did not capture those people because they needed to have symptoms in order to be, in order for them to say, oh, let's see if you have COVID, right? So what we cannot say yet, until we have more experience with immunizing more people, is that this vaccine can definitively stop transmission. And because we can't say that, because there's a possibility that you could have the vaccine and have really mild or no symptoms of COVID and maybe still pass that on to other people, we can't yet say that this vaccine stops transmission. I hope to be able to say that soon. We need more experience with that. And so because we can't say that yet, it's really important that even after we've immunized a bunch of people, there's going to be a time where people still have to wear facial coverings when you can't keep distance or where it's required, stay away from other people and physically distance, stay home when you're ill, which is just good advice generally, right? Do all of those public health measures until we have more evidence in the population that we can say, yeah, we're more confident that this vaccine interrupts or stops transmission of the disease. Okay. And then another question is, who is considered an essential worker? When can they get the vaccine? So there are a number of essential workers that are put into the province's plan for phase 2. Again, I'm going to read it out because I don't want to get it wrong. It's frontline essential workers, including first responders, teachers, and other education staff, and the food processing industry, and people who live and work in high-risk congregate settings, for example, shelters and community living. Now, is that definitive? Could it change? It could actually change, right? This is still early in the vaccine rollout, and probably these discussions are going to be ongoing, and those those eligible groups are going to be modified over time. I think you can expect that. Right now, those are the eligible groups that have been identified in the province's phase 2 of the plan. But of course, as things change, we'll keep changing with it. And lastly, maybe before we turn over to media questions, there's a question about, I'm a retired or current healthcare worker and I want to volunteer with helping with the vaccine rollout, and how can I help? So amazing, thank you. We really appreciate your interest in helping. Well, we have to figure out a few things, right? We're probably going to get you involved a little bit later when we have more vaccines and we have more things going on. But certainly on our webpage at Lambton Public Health, there's some forms that you can submit. It's just a quick submission and you can tell us what your name is and what your qualifications are and that you're interested, and we'll keep you on a list. One of the things we haven't worked out is with people who have a healthcare license but they're retired, whether or not they would be eligible to sort of resume that scope of practice, or whether we have to put them in a role that doesn't involve potentially actively immunizing or those kinds of things. We haven't really figured that out yet, but we're really appreciative that you want to come and help out because it's we really appreciate it. B, it's going to be a big effort that's gonna involve lots of different parties. So please let us know. We'll keep your name on a list, and as we learn more about how this is going to go, we can get in touch with you. So maybe I'll leave it there and turn it back over to the moderator.
Thank you, Dr. Ranade. We will now proceed with our media questions. We have some time specifically set aside to answer questions from media about COVID-19 vaccines. We'll begin with one question, one follow-up question, and if we have additional time after that, we'll open up for more questions. I'm going to introduce each media representative, and at that time you'll be unmuted, and then the floor will be yours to ask your question. We'll start with Colin Gowdy from Blackburn Radio Sarnia.
Hi there, Dr. Ranade. How's it going?
Hi, Colin. I'm okay. How are you?
Oh, not too bad. I just had one quick question. I was wondering if you could talk about which homes you're going to start with in terms of long-term care homes in Sarnia Lambton. Which one will be getting the vaccines first?
Sure, Colin. Yeah. So I don't want to preempt any other announcements that we might make, and of course, we kind of want to make that announcement after something's actually happened. But in principle, what we're really trying to do is we know that we're going to be able to get to all of the long-term care homes, retirement homes, given the vaccines that we're getting. But in the first bit of this, what we're trying to focus on is homes that are older, homes that potentially by virtue of their design or the way that they're built or made, they might have a harder time controlling an outbreak. And those are the ones that we already sort of knew about. They're called, I think they're called sort of they're designated as a C class, and I think it has to do with their age and structure. So those are the ones that we're going to first, and then we're going to move on to all of the other ones. But it's going to be very, very short order, I think. Sort of almost every day there'll be a new home that we're doing.
Perfect. That's the only question I had. Thanks so much.
Okay. Thanks, Colin.
Thank you, Colin. Our next media contact will be Heather Wright from the Independent of Petroleum in Central Lambton.
Hello.
Hi, Heather.
The government was saying that they wanted long-term care residents vaccinated first. However, there's a couple of fairly serious outbreaks in retirement homes. Do you have any discretion that you can go into the homes that are in outbreak?
Good question, Heather. So right now, the direction is to prioritize long-term care homes and high-risk retirement homes. For us, the what are called the high-risk retirement homes are the ones that are actually connected to a long-term care home. So it's the same facility, and we'll go and do those first. But the other ones are in short order. I think the other question, though, about immunizing during an outbreak is really this. We would love to go in and immunize as many people as we can as quickly as possible. When a home is in outbreak, it's likely to have a higher proportion of people who would not be able to get the vaccine because they're acutely ill, right? And so one of the things you want to do is be able to immunize as many people as you can when you get there. And if you have a high proportion of people who are already acutely ill, those people you would actually say, we want to postpone your immunization until you're feeling better. And so that's one of the reasons for sort of waiting until an outbreak has passed until you move in there to immunize. It's just the likelihood that you're going to find people who are ill is higher.
I'm also wondering what kind of assurances you're getting from the province about how much more vaccine will be on the way? Because this is only about half, right, for long-term care?
Right. And so we're hoping to get a round of vaccines supplied to us next week, and that would let us do a substantial portion of what we're trying to do. Again, the vaccine discussion, it's kind of like, it's not a static thing. It doesn't stay the same all the time. It's a very dynamic thing, right? So even the fact that we got vaccines now is something that we weren't quite expecting. We were expecting it to come a little later. So it's partially dependent on what vaccine supplies they have, partially dependent on where they've already pre-allocated those vaccines, because now we're moving into a place where some people actually need vaccine to be allocated to them in order to get a second dose, as well as others who need vaccine to be allocated to get a first dose, right? So I would say it's a really kind of fast evolving situation. We just try to stay on top of it. In terms of assurances, I mean, I think the main assurance is that they're doing everything that they can with what they have, but how you structure that and where it goes are ongoing conversations, right? Because you want to make sure people get a second dose, but you also want to give out first doses wherever you can. So that's the ongoing kind of tension.
Thank you.
Thank you, Heather. We'll move to our next media representative. We have Tyler Kula from The Observer.
Hi, Dr. Ranade.
Hi, Tyler.
So did anything change that specifically changed that the first shipment of vaccines arrived earlier than the week of February 1st, as was expected?
Yeah, I think it was two things, Tyler. So one of the things is that I think we were expecting to get Pfizer, right? And you've all seen what's happened with the Pfizer shipments and delays in their manufacturing and all of that stuff, right? It's a new vaccine. These things sort of happen. We have to sort of expect them and plan around them. And so what happened is that in order to make sure that everybody got some vaccine, they switched us over from what we were expecting to get, which is Pfizer, over to Moderna. That doesn't have a lot of implications for us locally because we were happy to give out either, and we had the ability to store and distribute either. Moderna is actually, in some sense, a little bit easier for us to work with because for reasons related to the vaccine itself, as well as the stability parameters of that vaccine. But having said that, we would have taken either. So that's really what happened. It's in response to the changes in the supply chain of Pfizer. They sort of shifted and reallocated and made Moderna doses available to us a little bit earlier.
I was also hoping you could talk a little bit more about the delivery schedule for the vaccine. Obviously, you mentioned that you're expecting another shipment to happen that week. How many vaccines are you expecting to arrive by early February?
So this week we got a batch. Next week we're expecting to get a batch, and so between the two batches, I think we're expecting just over 1,000, 1,100 doses, that kind of thing. But again, we don't have information on the future plans. So when are we going to get further shipments, right? So we're still waiting for that. I think everybody's sort of like, let's get this piece done, and there's, I'm sure, some background work happening at the ministry as well as with the federal government partners to sort of sketch out a larger timeline, which we just don't have yet.
Okay, thank you.
Thank you, Tyler. Our next media representative is Terry Doyle from Your TV.
Good morning, Dr. Ranade. How are you?
Hi, Terry. I'm okay. How are you?
Good. So I'll just throw it out there. There are people in the community and any community who question or wonder about the safety of a vaccine that came along fairly quickly, obviously because of all the work that was done by everyone behind the scenes. What message do you have for people that are still just wondering or questioning or curious about the safety of a vaccine that's still fairly new?
Sure. Great question, Terry. So totally understand that concern, right? Like it's a new thing and is it fast? Are there corners being cut? So I don't have an inside window into all of that, right? But I can tell you what these agencies are saying about what they've done, which is that, so the regulatory body, Health Canada, is saying that they didn't change any of the steps, but they did two things differently than they usually do. One is they put a lot more resources into evaluating and regulating this product because of the urgency of it. So they were working a bit faster than they usually do. But the second piece is that although they took all of the steps, one of the things that they allowed this time that they don't normally allow is for vaccine manufacturers to submit data to them basically as soon as they are receiving data from their trials, so that the regulators can see sort of as trials finish what the data are, usually they ask you to finish a whole block of trials, the phase 1, the phase 2, the phase 3, and then submit everything to Health Canada so that they review it, which then requires them to take a lot of time getting up to speed with what that vaccine is and how it's made and what it's supposed to do and what the evidence says. But because they had a lot of that information up front as the trials were proceeding, they were in a better position to go through all of the same steps, but just on a different kind of time scale in order to approve the vaccine, right? Things to remember. 1, the level and quality of evidence that is required for our regulators to approve a vaccine is substantially high. Right? This is not the kind of evidence that we're talking about for a lot of the other things that we generally think are good ideas. The evidence standard for the regulation of things that are injected into your body is incredibly high. So one of the things that we can be assured of is that when the regulator looks at the information and says, we think that this is safe and we're approving it for these uses, that they have enough information to know that the benefits outweigh the risks and that evidence is fairly certain around that, right? So like, let's think about the trials. Sorry, this is moving into a really long answer, but let's think about the trials that happened. And you're talking about each trial had sort of 18,000 people or more in the 2 different arms, right? So you have lots and lots of experience with giving people a vaccine, seeing what happens to them and seeing whether or not they get COVID. So we've got really good, high quality information coming out of those trials. So that's, I think, the message. It's that these vaccines really seem to be working well at preventing severe COVID-19 symptoms, right? And the outstanding questions are going to be, how long does that last? And how often might we have to revaccinate people over time, right? So we'll have to learn more about those things as we go. But in the first piece about it, like, is it safe and effective? Certainly for Moderna and Pfizer, the 2 that have been licensed so far, we can pretty clearly say yes on that.
Thank you.
Okay.
Thank you, Terry. Our next media representative is Troy Shantz from the Sarnia Journal.
Hi, Troy.
Hi, Dr. Ranade. Can you hear me all right?
Yes, yeah.
So as we know, you need 2 of these shots over time. So I was just wondering if you could explain kind of how that will be allocated. I know the ones coming in this week will, for their second shot, the people receiving this week, how is that planned out, and how long of a time frame is it going to be between the 2 shots?
Okay, great question, Troy. So let's talk about the Moderna, right? Because that's the one we're getting. But in principle, yep, it's 2 shots, and one of them is about 21 days apart. I think that's Pfizer. 28 days apart is Moderna. So you get 1 shot now, and then you get another shot 28 days later. That's how it was studied. But eventually, inevitably, even in these trials, you get people who are getting vaccine a bit later. So when they look at the data, they can say that there's pretty good data on effectiveness of the second dose up to about 42 days after the first dose. So there's a couple of things here. I think the goal here is to have enough vaccine to give everyone their second doses on time. So you get first dose in, and then with Moderna, you get the second dose in at day 28 or day 30. Thereabouts is great. And that would meet, the criteria of being very close to what was done in the trials. But what's happening is that there isn't enough vaccine. And so now you have to decide between giving more people first doses or ensuring that people who got their first dose get their second dose on time. And I think some jurisdictions, including Ontario, are saying we might be able to push out that second dose for some people in order to give more people first doses, right? That's a decision that's made based on both the need to get vaccine out to people and also some of the science around how it works. So let's go back to some of the science, right? What we know about most vaccines is that it's actually the minimum interval between doses that you want to protect. So with all the other vaccines that we have, if you get a dose later than the day you're supposed to get it, we count it. It's valid. We generally don't go back and restart the series. We say, that's fine. You got the doses that you need and the minimum interval was protected. So that's the assumption that we're making for these vaccines, because they, that they work like all of the other vaccines do. But I think that there's some hesitancy around that because it hasn't been specifically studied. So that's where we're facing this sort of dilemma about we don't have a specific study, but this is how all the other vaccines work, so it should work that way too, right? But the goal is get everyone's second dose in, respecting that minimum interval. And then if it has to be pushed out a bit longer, don't push it out too long.
Okay, and just to follow up to that, you said that they saying around 42 days.
Mhm.
Beyond that, for whatever reason, does somebody have to start over again? Like, how far can you go between doses?
Yeah, I mean, I think that there's no specific guidance on this yet, but you probably would not restart the series. So you would probably give a second dose and say your series has been completed. That's really what that's generally our approach to other vaccines. Now, if guidance or information from, for example, the National Advisory Committee on Immunization, if that changes, if they say, no, you should restart, then we would look into that. But for now, I think we would go with what we normally do for other vaccines, which is if one of your doses is late, for 2 doses, if your second dose is late, you just say you completed the series, and then you're fine. You move on.
Thank you.
Mm-hmm.
That concludes our session for today. I'm going to wrap it up at this time. I'd like to thank everybody for your participation. If you have any further questions regarding COVID-19 vaccines, please go to the website, getthevaccine.ca. The website will have information about local updates about vaccine rollout, frequently asked questions, and you have the opportunity to submit your question through a web form. We'd also encourage the public to attend our next radio community call-in session that is held this Thursday, January 28th at 8:30 a.m. with Sue Storr from Blackburn Radio. Tune in to CHOK or go to getthevaccine.ca for more information. Thank you, everybody, and have a wonderful day.